Hello everyone, it's Rock Materials. Welcome to my channel. Today I'm going to actually talk about using the knee, pretty much extending the knee, which means if it's bent coming up, and extending the hip. So if the hip is bent going up to drive power. Now this is actually, I pretty much didn't just use the way I do karate. I looked at other different arts that do this. For instance, I did look at boxing, and some styles of box, I guess some people, when they teach boxing, they use the knee and the hip extensions to drive power. Some people do it without talking about it. For some reason, they'll show that they're doing it, but they won't speak about it. And it may be that they just assume that it's common knowledge and that everyone's doing it. But it also may be that they don't realize that they're doing it because it's not done at a big level. But before I actually do get into that, I want to talk about something that happens in academia, which is called peer reviews. And I am going to mention a YouTube site, CecilRyuTaekwondo, because someone told me, oh, hey, they reviewed one of your videos, which I was pretty interested in. And I looked at their website, and I saw a lot of useful videos. Now, the reason I'm mentioning that is this. In academia, we do have something called peer review. What peer review means is when someone publishes an article in a peer-reviewed magazine, they look at the data. They go back and look at all their sources, see if their sources are correct. If it's something that was done using new science, new techniques, new medicines, they'll actually use it and compare it to the standard. What I mean by that is that I'll use the COVID-19. Medications are coming out saying, oh, well, this works. Well, a lot of those are based on peer-reviewed articles. Some of them are not. Some of them are opinion pieces. And some people are actually looking at data and saying, oh, here it is. Look, it works because of X, Y, Z. Other people will say, well, there's not a study that checks the medication versus with the treatment versus not having the treatment. Looking at both of them and independently, where the researcher himself doesn't know which is which. And there are some times where this is practical. There are some times that it isn't. If, for instance, someone starts an experiment doing this and they've seen that all the people who are using medication X are getting better and the people who are not, for instance, someone else is watching this, then it's a lot of times that people will say, well, look, let's stop the experiment. This obviously works. If that experiment is never done, we really don't know what happens. So in martial arts, I actually like the peer-reviewed, even when I'm wrong. If I do something and someone says, well, look, it doesn't work for me, I like to know that because then I can actually go back and why doesn't it work for someone? Now, sometimes it is that they're using it for a different defense. One thing that everyone knows in martial arts is one defense will work for one thing, but not for another. What I'm actually mean is, for instance, if we're using a block like this, it will work for certain defenses. But if someone's punching to the face and you're blocking down here, it's not going to protect your head. You're going to have to use a different type of block. And so that's one of the big things that does happen is in martial arts, as in everything else, not everything works for what it's supposed to. And so that's why peer reviews are so important. And so I would like to thank CecilRyuTaekwondo for checking out one of the techniques I did and seeing if it works for him. I really do appreciate it. And I would actually recommend looking at his videos and seeing what they do. Now, when I'm actually talking about this, remember, sometimes people don't use this. They use force in different ways. They actually use their body in a slightly different way to get the same result. That doesn't mean I'm wrong. It doesn't mean they're right. It doesn't mean they're wrong. It doesn't mean I'm right. It just means that sometimes there's different ways to do stuff. And that's one of the big things that does happen. Again, it is hard to take criticism sometimes, but especially when I've actually realized I'm wrong. One of the ones I always mention is a one-inch punch. I always thought, well, you're not going to get enough force. Someone said, try it, look at it, use a makiwara. And I did it, and it's like, oh, wow, yes, you do develop enough force to actually cause damage. And so that's one of the big things that, to me, is important. It's, can you cause the damage that you need with the technique? So there are different ways to do things. And so that's one thing to always remember, is just because one person says this is a way to do it, doesn't mean that's always the case. I actually do know that there are some people who are making their own martial arts, and sometimes they make their martial arts for different reasons. Some people make it because, hey, look, I have an art that works for me, but it's incomplete. So I'm going to mix something else and make something that works better for me than what I've actually learned. They make their own martial arts. There's no issue, especially if they're actually honest about it. If someone tells you, I'm making my own martial art, I used these 3 different martial arts which I study and formulated something that works best for me, that's fine. But if someone makes up their own martial art and says, well, I'm a ancient martial art, and that, this is where it came from, well, that's a little different. That really borders on fraud. There's also another thing that happens. Some people, there are some words that have specific meaning now. What I mean by that is mixed martial arts, MMA. A lot of people mix different martial arts and say, well, as I mix different martial arts together, it's MMA. Well, today, MMA is specifically a fighting sport that's in the gym. But for me, it's actually a great way to see if something works. I don't do it because I'm 45 years old, and I'm not going to heal as well as someone who's 35. Although I do know that there are some MMA fighters who are my age, or actually I think there's one gentleman who's even older. And so that's one of the big things to actually look at is sometimes, there are people who can do stuff and other people who can't. I'm one of the ones who wouldn't be able to survive at an MMA circle. I'm not ashamed to admit it. I've seen the athletes, and yeah, they're tough. But that's not where I'm going to go with this. What I am going to do is I want to talk about using the knee for power. Now, if you actually watch some boxers, you'll notice that when they drop a little and then come up with either an uppercut or hit to the body. Why they do this is actually what I'm going to talk about. If you look at this here, this would technically be your quadriceps muscles plus others. I'm not going to mention all of them. If you want, I can give you a list later. And these are some of the biggest muscles that you're going to find in your body. Now, interesting thing is, if you watch boxers, when they're actually punching, usually their weight is on their front leg, not on their back. They're not pushing off their back leg and leaving there. They sometimes will push off their back leg, they'll rotate, but then when they get into their front leg, they pretty much load that muscle and come up. Powerful punches coming up. Now, I'm not talking about the Street Fighter 2 video games where someone jumps up and does an uppercut. I'm just talking about a little bump forward based on using the quadriceps muscle. Well, when you are coming up like that, you're not just using the quadriceps muscle groups. You're also using this big muscle group in the back, your gluteus maximus. I want you to think about how big and strong these muscles are. If you stand all day, you're using those muscles. You actually need it to maintain this straight. Not as much as if you're running or doing squats, but if you think about it, you're doing squats, you're using quadriceps and glute muscles as well as other muscles I know, but just dealing with that part up there. So you actually can see how much force you have. If you can jump on one leg, you are using, or if you can do a one-legged squat, which I can do part of one, not complete. I have a lot of students who can. You are using these muscles. That means that you can develop enough power to lift pretty much your body completely with this muscle group. So as you come up using this muscle here, you can develop a little more power for the uppercut. And you can actually use this as an uppercut, not necessarily a block. You can also use it for the block like that, which has other reasons to do. There's other reasons to do it like that. And those are 2 muscles that are pretty important to actually do this. Now, those aren't the other muscles. If you actually go to a frontal view, you have a lot of muscles here called the adductors. The adductors technically bring the legs together, but if they're extended and they pull, they'll actually help with the extension of the hip. And so by using these, by coming up with the fork pretty much and using these, you can end up developing a lot more power than if you're actually just using certain things. Now, one thing to remember, sometimes people will keep the same height and use just the rotations. You can use these muscles for the rotation as well. And you may not necessarily lose force if you're going in a straight line. But if you're coming up, let's say you're actually doing an uppercut, using the muscles to bring your legs into the hit, can give you more power. Now, next time I am going to talk about rotating the hip, and it will use a lot of legs, it'll use a lot of muscles in different ways than most textbooks actually write them. The reason is a lot of times muscles do multiple movements depending on what other muscles are being used. And so that's one of the big things that does happen. There's so much I actually do want to talk about, but I will mention it in later episodes. Please, if you are one of the people who's involved in boxing or the old classic HEMA and are using something similar, please write it down. If you're not using it because you see a disadvantage to using these other muscles, please let me know, and we can actually review it, see why, if there's one thing that's better versus another. I hope you enjoy this, and you have a nice day.